Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations. What's going on, guys? Welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
Good, but I noticed you have something new on your head. What's that?
It's a little bit cold. Up here in Canada in November. So I got the toque on today. Just got to keep the ears warm.
I also got my winter tires on.
Yeah, it's
It's coming to that time, eh?
It's sad. I'm sad. Like, I think about waking up and walking outside and seeing a mass amount of snow on my car, and then I have to brush it off, and I'm cold.
Well, let's think positively, though. I mean, I usually get excited when there's snow for the first couple times, you know?
Yeah, that's pretty.
And you're like, hey, it looks good. Like, oh, snow, it's kind of like relaxing, like you're sitting inside, it looks good. But then you get like January, February, and you're like, okay, it's enough.
I'm good, bro. Get me back to the warmth.
Exactly.
Oh, man. All right, guys, we're back at it again this week. We're up over 40 episodes now.
Yeah.
Which is pretty sweet. Never thought that it would happen, but we're pretty excited, and we're excited to keep bringing you guys some more content. So me and Will are going to have a little discussion here today. No interview. And I'm going to let Will kind of introduce the topic of discussion today. So, Will?
Oh, boy.
Take it away, man.
There's a lot of pressure with that, Dalton.
No pressure.
I think something we wanted to talk about is dealing with ambiguity, dealing with kind of, and embracing that kind of gray area with, I guess, specifically with like healthcare, with physiotherapy and what we kind of deal with. But I think it could apply to lots of situations because I think, as we've talked about, embracing the ambiguity comes with challenges. It comes with stress.
Discomfort.
It's not easy. Yeah. But hopefully can kind of encourage us to embrace critical thinking and kind of grow in that regard.
Yeah, for sure. And I think it's tough. It's something that I know me and you have struggled with. Now being out in practice for a little over a month, a whole month. But you start to see where like this uncertainty and not really understanding or knowing what might specifically be going on is tough. And
at the end of an assessment, come up with like one thing that might be wrong with someone, and oftentimes like you don't know exactly you don't know exactly whether there is a specific kind of tissue pathology or something going on that you can give them a very clear answer, and in many things like there just isn't a clear answer. There's lots of ambiguous pains and stuff like that are highly perceptual, highly subjective, very challenging to come up with, one reason that somebody has that.
Right.
But I think, and from having discussions with people, it's very important to be okay with that.
Yeah. And I think that's the hardest part, right? Because we're almost bred in a way to have all those answers, which I think is good, like in ways, because like you want to learn as much as you can. You want to have the knowledge, like that's what school does to prepare you. But then once you get out and start to realize like that's not necessarily the case, it becomes hard. And I think the hardest thing that I've struggled with is conveying that to people and trying to like make them understand that like we might not be able to be as specific or certain as we thought or what they thought, because a lot of times they're coming in expecting you to have like a specific thing, and you might not have that, and you might not be giving them the answer that they want to hear. And I think a hard thing is trying to help them understand that. That's something that I've struggled with.
And helping them understand that just because you don't know what specifically, like I can't look in your, shoulder per se and be like, this is what your shoulder looks like based off of what my assessment tells me. Mm-hmm. But that doesn't mean that I can't help you. That
Right.
doesn't mean that we can't, establish a plan and go forward with it based off of, what we still know about pain and about sensitivity, about progressive exercise. We know what kinds of things, work, for example, like the rotator cuff. We know how to stress different tendons. We know how to ease off that stress. Like, there's lots of things that you can still carry forward with despite maybe not knowing exactly what tissue is kind of responsible for, is I guess being provoked.
Right.
Let's say. You can still have a plan.
Yes. When was when did you start to really realize that there was this big gray uncertain area? You know what I mean? Like when along the journey from like school until we started to, do our own learning, started talking to some more people. Was there a specific time that it really like switched for you, or that,
Well, I think what started happening for me is I started looking into things like, Peter O'Sullivan's work and stuff. And so I kind of saw these. So it started, I think, from back pain, mm-hmm. because I was always confused. I always thought growing up that, core stability was the only reason, or lack thereof, it was the only reason people had back pain, basically. Mm-hmm. That was what I kind of grew up thinking. And I started reading, and I think because we haven't really formed, years and years and years of knowledge in the area,
right.
I was pretty open to it.
Yeah.
So I started reading, and I'm like, man, this is complicated and multidimensional. There's lots of things that influence, like, sometimes more than you would think, like
sure.
all these other factors, and that, people can have kind of back pain where there's no, like it's prolonged for longer than a tissue would take to heal. Like, mm-hmm. there's all these things I was looking into. The fact that actually sometimes too much core activity
right.
could be contributing to someone feeling pain.
Yeah.
And I think once I started looking into that, I was like, yo, this is much more ambiguous, gray, and not simple. Like it's not something that you can explain in a very satisfying way to somebody. You know what I mean?
Yeah.
Because you can't just be like, what you need, sir, is core strength.
Right.
Which
would be like almost like, the simple or maybe more comfortable answer that you could give someone, right? Like,
yeah.
Oh, you need core strength because your back is, not stable enough, or whatever it is. You know what I mean? And like, we've started to realize that like it's definitely not that simple, right? And I think that's the hard part. I think as like physical therapists, like us going forward, coming from like my own perspective, is that like there's going to be times where it's going to be hard, it's going to be complicated, you're going to be super uncomfortable, and that not just like reverting to the most comfortable or simple answer just to give somebody something that you think they want to hear, than actually giving them what they need to hear, I think is important, right? Because if you're then conveying to someone that they need core strengthening, like they need that to stabilize their spine because it's not stable, you know what I mean? Mm-hmm. Now they're inherently thinking like, oh my God, like I'm not stable, blah, 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 blah. Maybe they are, maybe they're not, right? Mm-hmm. It's hard to tell how they're going to perceive it, but you're not 100% like certain on mm-hmm. that. And then again, it's, following up with some research in terms of like showing that there's many other factors that play into it, and it's not, your spine isn't unstable, you know mm-hmm. what I mean? Like core exercises, sure, they can help you, mm-hmm. no doubt, but that might not be like the one thing, right?
Well, and that's the benefit of embracing that gray area and uncertainty, as you start to look into it, like, okay, sometimes core exercises help people, so why?
Right.
Why, if it's not, increasing the stability of their spine or something like that.
Yeah.
You know, what are other reasons why it might help? And then you kind of start diving into things like, you know, that we've been diving into, like, well, realizing people are humans. They have emotions, fears, past memories, experiences, all those things come into play. So you start kind of putting some things together. You know, it's not perfect, but it encourages you to look into things, you know?
Yeah.
I think there's been many examples of various things we've seen that we've began to question and look into, and we do not like have all the answers. We don't understand it all, but I think recognizing that and being humble in that is really important.
Yeah, and that's what drives your critical thinking, that drives your development as like a physical therapist or as a person, like continuing to look into things and trying to, if something doesn't make sense, you know what I mean, or something there's one answer for something, like that's probably not right. Like we need to like look a little bit more into it or do a little bit more learning. I think that for me is what opened my eyes to things, was like I was started to question like just like this one specific thing is what's going to help, or like we're going to diagnose it by doing this, you know what I mean? I'm like started to, and because I started to see in myself, like going through my own injuries or like when you're out on placement, and now for sure 100% like out on practice, you start seeing like, yo, there's not just one thing going on here most of the time, right? Like there's so many other factors that play such a huge role. And I think for me, and I think we've talked about this, but when I started like understanding like the biopsychosocial approach and started understanding that there's so many factors that play into it and that we can't be as certain as we can, it's like it's challenging and sometimes scary, but at the same time I almost felt a little bit like liberated in a way, because like learning that strictly biomedical approach in school was like super hard, you know what I mean, in the way of like you have to like there's a lot of pressure on you to like be the person that's like gonna, you know, do all of these tests and listen to the subjective assessment and do all these objective tests, and then you have to come up with one specific structure, one thing that you're gonna tell that person, and you're gonna do things to that person, or you're gonna come up with a plan to like get that. All of this pressure's on you, and then you got to stop and be like, yo, there's a human sitting across in front of you. Like there's a lot of things that they need to do. They're not just one person. Like there's so many factors. Like they have to be committed to doing it. They have to want to change. They have to be open to changing things in their life that they have strong beliefs in. Like there's a lot of things going on there.
They have to think that they could possibly return to some of those things that they may have been doing and now they're not.
Right.
Like there's so many factors. Even something as simple as whether somebody thinks they need an MRI or not, that influences things. You know, like there's so many different factors that come into play that I think what we'll get better at, hopefully, is sifting those out, you know, sifting out what is the most important thing to try to address, you know, what are the things that we could maybe address. And I think for us too, where we're at now, we don't necessarily understand all the, let's say, like biology that well, or like some of the different processes that we're learning about in research and stuff, like,
right.
And so being then confident in your explanations in clinic is tough because we still have a lot to learn.
Yeah.
And hopefully learning some of that over time, you know, becoming more confident and having already embraced the kind of like gray areas, hopefully those kind of start to blend together where we're not only knowing more, but we're getting better at conveying that knowledge in a way that's accessible.
Yeah, that's huge. That's a good point, man, because I think, and for me too, is like you put a lot of pressure on yourself because you know that there's a lot out there that you want to learn to be able to help people, but you have to be realistic in the sense like you have to trust the process in terms of learning. Like it's gonna take a long time, and I think like social media and the conversations that we've had with people have been great. Like they've helped us so much, you know what I mean? But at the same time, you almost feel a sense of pressure at times to like be like, whoa, like I don't know that much. I need to be doing this 24/7 all the time. But realistically, like those people took time to develop. Yeah. And I think like what you just said is huge, is like if you can accept being comfortable with the uncertainty and then continue to seek out the knowledge to develop your thought process and your understanding of these things to then be able to convey them with conviction and confidence, that's when it all starts coming together. And that's not going to happen with a month out of practice like me and you have been doing, right?
Right.
And so to accept that is, I think, important.
Yeah.
But to also not be like complacent with being like, okay, I'm just gonna accept that because I'm like new. Like, no, you gotta work towards getting to that level, right? And I think, you know, we've talked to people like Jared, like when we had the conversation with Jared Hall, like that guy is putting out great content. He's helping a lot of people. He's super smart. You know what I mean? Like he's putting out this information and he knows a lot of stuff. And then he's still sitting there and saying like, he's still learning and struggling with those things. It's like, okay, you know, like everyone's going through it, you know, but you got to continue to fight the battle. And I think that's why embracing the critical thinking model or idea is so important for our profession.
Yeah,
you know?
Exactly. Because the flip side can occur where you realize uncertainty's uncomfortable, it's hard. You often sometimes feel kind of dumb, to be honest.
Yeah.
Like, if I'm just going to be honest, you feel dumb sometimes because you're like, well, I can't give this person the best answer. I wish I gave them a better answer that, you know, put them on a better path, you know, but you're going to make those mistakes. But the flip side is not being okay with that and just giving an answer that seems logical just so you can give somebody an answer. And then you're stunting your potential for growth, your potential to learn those things and to bring a better answer, you know, that's more accurate.
Yeah.
That's less wrong.
Yeah.
And I think, to be honest, I saw that a lot when I was on placement.
Well, I think it's in general, it's what's going on with our profession in a way at times. Like, I think you get a little stagnant, you know what I mean? Like, and we've all been there, and like, it's like you said, it's easier to do those things. And I think like now we're starting to realize with all this information and the learning that we're doing that like we can push this forward, but here's what we need to do. Like, we need to change. We need to be okay with the uncertainty, you know. We need to continue to develop. We can't just do what we've always done, like, you know what I mean, just because that's what we've always done. And I think that's something that, and that's not just in physio, that's in everything. Like,
exactly.
that's in people's life, that's in other professions.
Yeah.
And I get so hyped up because I think like what we have as a profession, like as physical therapists, can really help a lot of people if we continue to adopt and push forward. And I think we can have a big impact. Like, a combination of the skill set that we have is going to be huge for people, man. Like, huge. And I just want to continue to develop and help and be part of the wave of like moving this forward, because we have a lot to offer people that need the help, you know?
Yeah.
This coffee, man.
This coffee's good. What do you think? It's like some special. We went to Starbucks and they offered.
We got the bougie Starbucks. we up to like the clover. What is it, like the clover? I don't even know. But
I'm not sure. Like,
they said it's supposed to be warmer and more smooth, and I took a sip of it and I'm just like, they got me. Like, they got me the extra 50 cents for this cup of coffee.
Like, it's decent, but yeah. I mean, it's not that much different.
I don't know if it was worth the extra 30 cents, bro.
All right.
Let's I guess maybe give some tangible things that you've done or to try to be confident in conveying to someone the uncertainty of their situation, like not giving them maybe a specific answer. Has there been things that you've tried to do or gone through?
Yeah, it's never the same because people ask different questions. People ask really difficult questions, you know, questions that are so hard to answer. It's almost impossible to give a perfect answer. Some things that have really helped me are just like focusing on the positives, like focusing on things that people can do and trying to direct them toward like a goal, towards something that maybe they're missing that they want to do. rather than focusing on the elimination of pain. I think that's like something that's really like helped me. And also the way that I describe pain, like I am very consistent. I almost never deviate from describing pain as more of a sensitivity. Like that has helped me a lot because I think people can understand sensitivity.
Yeah.
You can understand, you know, when you have like a sunburn and you're more sensitive. And so describing things that way with that narrative has really helped because then you can describe the things that they're sensitive to.
Right.
And then you can be like, okay, so knowing that, what we can do is we can try to apply some stimulus that hopefully will allow that sensitivity to come down, meaning temporarily reducing some of the loads on these things, you know. So that kind of has helped a lot, right?
Yeah.
Because I think people can get that. It doesn't always work,
No.
and it's not perfect, but it has helped me portray some confidence in something that's very multi-dimensional.
Right.
So I try to, like, you know, enter it that way, just something that's very simple. And then it depends on the person and what they need and where they're at. Like sometimes I've found like they'll start bringing up other factors that contribute, and you just kind of reinforce it.
You're like, yo, okay. Yeah. No, that's a good point. Yeah.
Yeah. Then I think like we both kind of looked into like a lot of analogies and stuff, eh?
Yeah, and that's something, again, like it's always learning, right? And like trying to implement those are tough. Like, again, I just got Jared's book. Haven't dove into it too much, but I've been reading it. But like having those things, those analogies to be able to describe to people, I've noticed that it can really help. And it's something, again, that I struggle with the delivery, but like watching other people deliver it, like other people like Nick, for example, who I'm in the clinic with him. Like I watch him talking with patients, and when he gives an analogy that people understand, like you can really see the transition in that person's thoughts. And I'm just like, whoa. I'm like, okay, like note that, you know what I mean? Like I think the analogies and just trying to give people an understanding, a way that they can understand it and then try to remember it is huge. And I really like the point that you made in terms of like setting that baseline understanding of sensitivity and trying to like have that be like the narrative that you're always using. I think that's really important. I've tried to do that myself as well, and again, it can be difficult at times, but I think that's important because then everything you layer on top can be around that idea of pain as like a sensitivity. You know? Yeah, for sure. And then I think something I've tried to do is like take like what they want to get back to or their goals and make that like the center focus of everything that we're doing. You know what I mean? Like everything that going forward is going to be to get you back to what you want to do. And then it's important to set that as off the bat as you can. And again, it's hard because a lot of people come into you without maybe a specific goal. And a lot of times the goal is like, I don't want to be in pain anymore. And then, you know, like that's a dangerous thing to have as your one goal. And I think it's hard, again, as a new physio to try to like redirect and reframe that at times. But that's something I've tried to do is like, okay, let's take it away from like completely eliminating your pain to like getting you back to like doing something as simple as like if it's just walking your dog, like if that's something you like to do and you haven't been doing it, okay, that's our goal, you know. And like try to help them come up with goals that they can use as like an aim instead of it just being pain. You know. Yeah,
I agree. I don't know if it's the right approach, but I have like told people that I can't do that. Like, you know, like I can't remove pain.
Yeah.
You know, and I think I'm just trying to be honest, you know, like not that we can't modify pain. We can modify symptoms, but I can't remove pain, and I don't think it's good to send that message.
Oh.
Because it keeps people like perpetually looking through the loop of healthcare of like what can solve their problem.
Take my pain away.
Yeah.
And I think like we know that like pain is obviously always most of the time seen as a negative, but again, like trying to reframe it as something that's like a positive,
an opportunity to engage in different like behaviors that might be beneficial to you,
right?
You know, into what you like doing and what you are like.
Yeah, for sure. It's difficult, man. It's challenging. It's something that I continue to struggle with, but I think it comes with the territory, and it comes with the time of like continuing to develop. And I think like us having these conversations with each other, like this conversation, even though we're recording it, is much of like us just helping each other out and like going through the struggles that we're going through. But at the same time, I think it's good for other people to hear it, especially if it's like other students. Like I hope that other students hear it, and like, or other new grads or other people that are going through the kind of feeling the same thing, like understand that like, man, everyone's going through it, you know, like we're all trying to figure this out. But like as long as you're coming from that place of like consistent growth and getting better and trying to move our ability as a profession forward, I think like we're on the right track. But it can get hard, man.
Yeah, but I think the key message we're trying to like convey is that it's okay to be uncertain, and it's okay to not have all the answers. It's not okay to not have all the answers and say things that you know are wrong. Right. I think that's like, you know, that's not doing anybody any good. It's not moving anything forward. You know, in order to move forward, we have to question what we think we know, you know, to go forward. So,
and that comes from a good place.
Yeah.
That comes from a positive place, not like a negative thing.
No, of just wanting things to be better so that people can get more useful help.
Yeah, man. Well, I'm coming to the bottom of my $2.63 specialty Starbucks coffee. So I think we should wrap it up there.
Cheers. Let's do it.
Yeah.
Let's wrap that up.
Guys, that's we'll end it there. We hope you enjoyed the episode. You know, we kind of just talk on these ones, and I think me and Will have started to like enjoy it. So give us some feedback on it. Like, are you guys enjoying these episodes? Do you hate it?
Come on.
You know, I think we're going to continue to do it anyway, but we have a lot of fun doing these ones. So we'd love to hear your feedback. If you guys want to reach us, obviously you can reach us on social media at the MVMTPTs on Instagram, Facebook, and Twitter. You can reach out to us via email at themovementpts@gmail.com. If you guys enjoyed this episode or any one of our other episodes, we'd really appreciate if you could head over to iTunes and drop us a review and subscribe and give us a rating. Like, we really, really would appreciate it. It helps our podcast continue to move up the rankings. And coming down the pipe, once we finish up this exam and we can start putting a little bit more effort into like really taking our stuff to the next level, you know, we're going to start doing some little like giveaway things or some incentives to like have you guys do that for us, which is also going to give you some cool stuff. So we're looking forward to that. Will, you got anything else?
No, I think you know, maybe just like a bit of a shout out to some of the people that have kind of like helped us like embrace this kind of ambiguity, you know, like
give them some love, man. Shout them out.
Like, you know, like Zach Gabor has been huge with like pushing us to like embrace the gray, you know, so shout out to Zach, you know, shout out to your coworker Nick Hannah
Moves,
who's always like, you know, challenging ideas and like, you know, things that kind of sometimes could maybe make you, you know, annoyed, but then you're like, okay, well, I gotta think about this more, you know. Even just like past guests like Jared and you know, Adam Meekins and Greg Lehman and, you know, really anybody, Emma.
Yeah, Emma for sure.
There's lots of people who have kind of just like pushed us to like to challenge the ways that we're thinking and to hopefully encourage others to do the same. So
yeah, for sure. And there's a lot of people out there like those people that are going to support you and give you good advice if you're looking for it. You know, like all of those people are open to helping, you know. And I think it's important for people to understand, like, you know, reach out to those people, find those people, and continue to fight the good fight, man. That's all you can do. All right, guys, we're going to stop talking now. Hopefully you enjoyed it. We'll talk to you later. Peace.